Hi everyone, welcome to today's Facebook Live. Thanks for joining me. I know I had about 2 weeks off with just a lot of different things personally going on in my life, but I'm back again here with this Facebook Live. And today I am broadcasting from Oka Veterinary Clinic here in Tuscola, Illinois. I am filling in for Dr. Coons, who owns a practice now. So today I am going to talk about probiotics, using probiotics in cats to help reduce anxiety as well as to help improve their health. And there has been a recently published study, this one here, let me get the right direction here. This is a study published from Colorado State University College of Veterinary Medicine together with Purina. And it's where they took the product, which is the Canine Calm probiotic, and they used it on cats in a study. And they monitored the cats for both signs of anxiety as well as these were known feline herpes virus carrier cats. So all of the cats in the study, both the placebo group and the group with the trial, had tested positive or were known to have feline herpes virus. And as we all know, feline herpes virus, it's lifelong, and it can really cause some very debilitating signs and symptoms in cats, especially when cats are in housing, a shelter situation, have other concurrent illness, change in environment, stressors, going on. And so in this study, it was a 12-week study. They had half the group of 24 cats that had a placebo type supplement. Now, this is an abbreviated, abstract, and I'm not quite clear if it was a different probiotic or maybe just the granules, that was the base flavoring agent, in this probiotic. Watch my Facebook post at my blog. I'll try to take the time to read more specifically about it. But anyway, a placebo, and then the Canine Calm probiotic. Now, the Canine Calm, the bacterium that's in there is Bifidobacterium longum. And so they fed the cats, the first group of cats, this for the 6 weeks to get it, and then the placebo group for 6 weeks to get it established in their system. And then for 2 weeks at a time, they would exchange the cats from being in, one housing situation into independent caging situations for 2 weeks, and then out and then back in, to give them like a stress period, then a relief period, then a stress period. And what they found was that the cats who were on this probiotic had significantly less signs and symptoms, the runny eyes, the red irritated eyes, runny nose, lack of appetite, nasal congestion, etc., related to herpes virus activation in their system and then causing those signs and symptoms. What they also found were the cats that were on this probiotic they would come more forward to the cage. The behavior changes were during the times the cats were housed in cages, those supplemented with the probiotic were significantly more likely to reach out to the scorers through the cage bars and significantly less likely to pace in the cages. So they had just a couple of behavioral parameters that they were measuring. But compared to the other cats who were on the placebo, these cats were showing more affiliative behaviors and less, pacing, that physical movement, that physical, agitation, if you will. And I did a previous Facebook live, video, and it's on my YouTube channel about, tracking what these changes are for cats when they're in a cage situation. Anyway, these cats showed less of that as compared to the placebo group. Now, the clinical changes were that during the stress periods, the cats supplemented with the probiotic were significantly less likely to exhibit sneezing. So sneezing was the measurement that the physical symptom that they were measuring. And they did also measure biochemically. They did blood chemistries and found that during the stress periods, the cats supplemented with probiotic were significantly less likely to have abnormal serum cortisol concentrations. So that's that evidence of the reduced stress response. Not only our behavioral observations, not only the physical observations of less sneezing, but we're also doing a physical measurement of baseline of cortisol levels in the stressed periods and seeing that those were not abnormal, they were not elevated, okay? So what we can take away from this is that the Calming Care probiotic is well tolerated, reduces stress, and reduces the stress-associated problems like reactivation of that feline herpes virus and increased social interactions between cats and people. So all this is really important. If any of you have ever had a cat with feline herpes virus, or veterinarians, technicians, shelter care management members out there, you know how difficult it can be for managing, helping these cats to have good welfare and good health with the herpes virus. And even though they may not look outwardly stressed, and that's what I find gets really frustrating with some of our, cat owners, is that it's like, man, his eyes are getting red and runny and they're so irritated, and the Famovir and these other drugs are expensive and I need to bring him in for another exam, and that stresses him out. And it just, it's a very frustrating disease, as well as can be very debilitating, especially in the young cats and these kittens. So supplementing the cats with the probiotic early on and using that as a maintenance product can be very helpful in managing these cats with the herpes virus, as well as helping to improve behaviors, because we know that the stress is any kind of a stressor not only is going to cause physical, physical changes to show up, it's also going to then cause those, behavioral changes, that hiding, we may get hiding, not wanting to be touched, not doing allo grooming, and this is going to aggravate inter-cat aggression in the home, owner-directed aggression, and then again, now the cats are even more stressed in the home, so it becomes this vicious cycle. I think it's important to note, Dr. Lappin, see his nice little picture there on the handout, in 2009 had also published a study where Fortiflora was used for cats in a shelter as to test out to see how this would have an effect on cats with feline herpes virus. And they found that Fortiflora did help to decrease a lot of the sneezing and clinical signs of the feline herpes virus. At that time, they were not measuring any behavioral changes. And I attended a lecture in 2009 that Dr. Lappin had presented this study. He's a very entertaining speaker. And he had commented about how, the cats in the social colony room actually were a bit more stressed than when they were alone. And anyway, he was aware of stress factors being a matter, being of concern in the shelters. And again, this was, 12 years ago, and a lot has advanced for how we help our cats do better and manage in shelters than then. But the impact and benefit of probiotics for our cats has been known for a long time. And this study is helping to refine our knowledge even more, where we have that blood-brain connection, where we're seeing the physical health has an impact on the behavioral health. This whole area of probiotics and physical health management and mental health management is really expanding and growing quite a bit in human medicine. Right before getting on air here, I did a quick look up on what I could find for what we know about probiotics, anxiety reduction, and anything more about mechanism of action, and data. And much is being done and brought up on the human side. And, it probably is time for another Facebook live, presentation. Yet some of the things that we do know, and again, we can extrapolate this probably to our veterinary side. At some point we'll probably have the money and the studies done to analyze this on the veterinary side. But the vagus nerve is very important. And the vagus nerve, of course, coming from the brain down to the body, innervates the gut, the intestines. It also has branches going to the heart. And the microbiome in human side, okay, this is from human research, they have found that the changes in the microbiome, so when a probiotic or prebiotic has been used, so prebiotics are things like the fiber and the nutrients that help the bacteria to grow. A probiotic is the actual bacterium that you're taking as a dose to kind of inoculate yourself with it and get that going in your gut. Anyway, there's a change in the gut microbiome that releases cytokines that affect the vagus nerve. And in that effect, the vagus nerve then has supply to the hypothalamus, the pituitary gland, and then to the adrenal gland and other hormone-producing glands. So this is how you get that interplay between the gut, the brain, and then behavior. And also what's been found is Certain cytokines also can directly cross the blood-brain barrier and have direct effects then on behavior. Oftentimes, again, with the probiotics, it's creating certain cytokines that actually then decrease anxiety. And lastly, the importance of certain amino acids in this whole, biochemical management interplay with neurology, and that tryptophan plays an important role. It may be at a low level needed in the diet, but it does have an important role. Well, thank you very much for joining me today. I look forward to your comments, and watch my YouTube channel. I'm going to save this and I'll post it up on my YouTube channel, which is drsallyjfoote.com. And thank you very much and have a great day. Bye-bye.